One of the things that I remember most from chiropractic school was that I was really trying to learn how to help my patients. And that was noble of me. But what I should have or could have been more focused on was cooperating with the instructors and graduating from chiropractic school. It took me about 5 long, hard years to go through chiropractic school. I transferred from Life Chiropractic College West, Southern California University of Health Sciences School of Acupuncture and Oriental Medicine in Whittier, California, Southern California University of Health Sciences, to go to Life Chiropractic College West because I just wasn't learning much at Life Chiropractic College West. What they were teaching was that my job as a chiropractor who could heal, theoretically, the reason I went to, at least the reason I started going to chiropractic school and acupuncture school to begin with was because I knew that I could heal people. I knew that if I was taught the basic skills needed, that I could help sick people that were turning to drugs, radiation, and surgery. I could help those people to escape the conventional medicine, insurance-based cabal so that they no longer had to suffer from unnecessary, dangerous surgeries and extremely dangerous, poisonous, toxic prescription medications, each with over 70 different side effects. The more I learned at Life Chiropractic College West, the more I learned at Southern California University of Health Sciences, Los Angeles College of Chiropractic, with all due respect to the faculty and the students who helped me to leave and go to Life Chiropractic College West, the more I learned, the more disgruntled I became, because they were a very political group and they were basically teaching their doctors to refer out to medical doctors for every little thing that they weren't sure about. High blood pressure, refer to the medical doctor. Aches and pains that don't go away after 2 or 3 visits in the back, shoulder, spine, whatever, refer out to the medical doctor. Problem with hair loss, refer out to the medical doctor. Problem with this, that, or the other, refer out to the medical doctor. I didn't want to be a metapractor. Okay. I didn't want to be a metapractor. I didn't want to be somebody who couldn't figure out what was going on to help my patients. I wanted the medical doctors to refer to me, if anything, because they weren't able to help and I was. And that was the whole key. There's this one fellow, I can remember, for some reason, I guess it seems like a whole lifetime ago. His name was Misha or something like that. Micah, that was his name, Micah. Very popular guy. Ladies loved him. Blue eyes, from San Diego, curly hair, curly blonde hair. Anyway, this guy was one of the top students of every class I was in, and yet he was sort of a laid back, not a very hard studying guy, but he had studied all the anatomy and physiology and biomechanics, and his he studied all this kind of stuff, right? He studied the histology, the composition of the different cells and the different organs and glands. He studied all the microbiology. He'd just been through all this before, so it was pretty easy for him. And I just remember him saying to me once, and by the way, his father is a real successful chiropractor in San Diego, still is, I suppose, who was making over $1 million a year. I guess he took over his father's practice along with his brother, who was also in school there. And I remember him saying, they're just teaching us to refer out, but when I have my practice, I'm going to probably want to hire a medical doctor to be in my practice so that I don't have to refer out. They can just be on call if we need to prescribe any meds for anything or change the medication. And I thought, well, that makes sense. That's pretty smart, right? So why would we want to be referring all of our business and all the things that we're able to help with to somebody who can't help? Anyway, when I was in my classes, hey, Mom. Okay. When I was in my classes, a lot of times I was asking, what about, an oxygen hyperbaric chamber? You know, does it make any sense to have our patient go into an oxygen hyperbaric chamber? And a lot of times there just wasn't any forum for that because it was all about passing the tests, right? Cooperate and graduate, jump over the hoops, right? Get out of chiropractic school. So they were at either school. They were still, you know, real hesitant to want to go over anything outside of the necessary curriculum. Other times I was asking, you know, well, what about fungal infections and dysbiosis? How often does that come up? And why aren't we really studying that very much? No, that's not really a part of healthcare. That's not even a real thing. That's just something that somebody made up. Okay, well, what about hypoadrenia? You're saying that if the kidneys aren't working right, there's a problem with potassium and sodium. What about the adrenal glands? Doesn't aldosterone from the mineral corticoid, the main mineral corticoid that comes from the adrenal cortex, doesn't that regulate sodium and potassium balance in the blood, as well as blood pressure through the renin angiotensin system with the conversion of angiotensin 1 to angiotensin 2 in the distal renal tubules of the kidney? Doesn't that have anything to do with blood pressure and sodium and potassium balance? And isn't a severe adrenal problem relating to some of these electrolytes like chloride, sodium, potassium, calcium, and magnesium? And so, but on the test, they just wanted me to have a certain answer. The answer wasn't necessarily the correct answer. It was just the answer that they wanted me to have. That's my experience. I'm Dr. Ilya Skolnikoff, creator and founder of the